Entertainment and community information. Hope FM 103.9.
Hello, it's Meredith Waters on 103.9 Hope FM, where we bring hope, share joy, and build community. And we love getting out into the community and meeting with people who do amazing things. And I have a theory that just about everyone has an amazing story or does amazing things in our community. And today, I am very fortunate, blessed, to come and talk with the really, really lovely Jo Ramsell. She is the breast cancer nurse at our local hospital, and she also works in the chemotherapy area, and she's here today to tell us lots of good information that we can rely on, because I think that's really important. There's a lot of misinformation and not gossip, but, people may be well-meaning, but it's just not accurate. And so it's really, really helpful to know that what Jo says is the truth. So hello, Jo.
Hello, Meredith. Thank you for the opportunity to come onto your show today and just have a little chat about my role. So as Meredith said, I'm the McGrath Foundation breast cancer nurse based up at the Esperance Hospital, and I've been in this role for 7 years now, and it is one that I do enjoy. I work at a part-time basis, so I'm usually here 2 days a week. Those days do vary. I'd like to say normally Tuesdays and Thursdays, but I also work in our chemotherapy unit. I'm one of the nurses in there, so I just work as I'm required to. So I'm here mostly those days, but if I'm needed in our chemotherapy unit, that's where I'll be. But I'll leave my details at the end if anyone does need to contact the office. They're most welcome to do that. So my role is to offer education, support, and help women and their families navigate the journey once a diagnosis of breast cancer has been made. Because as most of your listeners know, patients do generally have to go to Perth for the surgery component of breast cancer treatment, but it's just helping to coordinate all of that. And it's a familiar face, really, when you come back to Esperance, and just someone to connect in with and to be connected into other services so that you can get the support that you need when you need it.
Can you give us a little bit of insight of maybe what the first couple of steps are post a diagnosis? I know that no one really wants it, but I think knowledge also helps reduce fear and anxiety. So the more that we can know, the more we can navigate more effectively. So can you give us a few tips or just, what are the common steps?
I certainly can. I will just use an example. Not everybody's cancer is diagnosed this way, but I will use a very common example. So as many of your listeners know, we're very fortunate to have the breast screen mammogram bus that comes down. It's annually now, so I'll talk a little bit more about that shortly. But generally when women go for a mammogram, that's when things may be detected. Not always, but that's generally when things are detected. And then from there, you'll get a letter to say further investigation might be needed, and you see your GP, who will then refer you up to the tertiary hospitals, whether that's Fiona Stanley or you choose to go privately. So you go up there, they do a bit more investigation. They might do ultrasounds, biopsies, generally have a good look around, and then they might say, yes, actually, there's something that we're not happy with, and you'll be scheduled for surgery. So in that time, you usually come back to Esperance, and then you might go back up again with that fixed date for your surgery. And then after surgery, you might come back down to us with the results, and then you'll have a bit of a plan of action, whether you need to have further surgery or whether you need to have chemotherapy or whether you need to have radiation therapy or a combination of all of that. That's up to the oncologist there. So the surgery, obviously, you need to have done in Perth, and the radiation component of your treatment, we can't do that here. You need to go to either Bunbury or back up to Perth for that. But the chemotherapy component of your treatment is something that we can offer here locally.
That is great news. I know it's a sad topic, but it is great news because I have discovered that there are lots of people who experience cancer, particularly it seems particularly in this town. So I think any reducing of travel can be really, really helpful. And I was just going to divert to that very question, that it does seem, like I get asked a lot, does Esperance have a higher than average proportion of people experiencing cancer for the population? Do you have any information on that?
So I was pondering this earlier, and when I first started in this role over 7 years ago, I asked myself the very same question, because it seemed to me that every second person seemed to have some form of cancer in one way or another. And I thought, how can that be? Like, we're just a small town. How can that be? And research and the statistics, which you're welcome to look up yourself, go to Cancer Australia, you'll find a lot of information there and statistics about the different types of cancers. It actually is that it's not that Esperance has more cancer, it's just that we tend to know a lot more people in our community. So per head of population and statistically, we are actually on par with other regional towns around Australia. Yes, so it does feel like every second person that we see is going through treatment or is heading to Perth for treatment or is recovering from treatment. It does feel like that at times. But statistically, no. And it's more because we actually know people in our community. And as I was saying to Meredith earlier, it's our children may play sport together, or we may see each other at the shops, but they're sort of casual acquaintances. But because we're such a great community, we tend to know people on a slightly deeper level. And that's why I think it does feel like more people in Esperance have cancer.
Well, that is a relief to know that the perception is because we're all well connected.
That's right.
It's a good thing. So you mentioned about the breast van coming. So let's get those details out so that people can take note of them.
Certainly. So the Breast Screen WA, they come down in their mobile bus. I imagine many of your listeners are familiar with the great big pink bus, and it parks usually behind the RSL building, just in that car park there. So this year they're coming down the 14th of December right through to the 28th of March. So they're down for the couple of months. Next year they'll come down for a couple of weeks. So they tend to alternate every second year. They're down for the longer length of time. So we're just about in December now. So can I encourage your listeners, if you're between the ages of 50 and 74, if you haven't already received your reminder letter in the mail, to actually contact Breast Screen. You can either phone on 13 20 50, or you can book online. You just go to the Breast Screen WA website, just Google that, and it will come up with the information that you need. And just to really use this service, because I think, like with any screening service, if we don't actually use it, we don't want to lose it. So, and I'm sure many of your listeners would much rather be able to pop in and have this done rather than, travelling to Perth to have it done. So if I can encourage all your listeners between the ages of 50 and 74 to actually go and book online or make that phone call, 13 20 50. Breast Screen WA. Now, if I might, there is usually another question I get asked is, if I'm less than 50 years of age, can I have a mammogram? And the answer is, if you are between 40 and 50, you can have a mammogram. It's just that the target age group that they're actually trying to capture is 50 to 74. So that's why all the advertising material you see has 50 to 74. But if you are between 40 and 50, they do say, yes, you can go and have a mammogram. You do not need a GP referral. You just might not be able to book online because you might have to answer a few extra questions. So you just need to phone them. And I've been twice now, and it's not my favourite thing to do, but I know that once it's done, I'm good to go for another 2 years. So if I can encourage your listeners to, pick up the phone and make that phone call. The other thing I'm asked is, well, what if I'm over 74? Why can't I go and have a mammogram? And the reason, again, is just that's their target age group. And if you are over 74, it's not that you can't have a mammogram, it's just that you fall outside the target age group. But if you would like to have a mammogram and you're outside of that age group, then do feel free. You might, again, just need to phone rather than book online. That's all it is, really.
Think that's covered. So thank you for those. And is there any other common questions that you often get that would be helpful to, preempt or provide the information for?
The other one I get is, does it cost? And the answer is no, it is a free screening mammogram. And the other question I get asked is, I've missed, sometimes people are away or they've missed it. Breast Screen visits about 100 rural towns. So it's heading to Norseman currently, and then it will come down to us. And then it goes on usually to Ravensthorpe and Hopetown and so on. So if you've missed it in Esperance, you can chase it around the countryside. My suggestion would be to take advantage of it while it's here.
Most definitely. And are they 5 days a week, or is it part-time, or how does that work?
It is usually 5 days a week. I believe it's 8 till about 5, 6-ish, but don't quote me. They'll tell you that when you go to book your appointment. Because it's here over the Christmas, New Year period, I suspect strongly they won't be open on Christmas Day or New Year's Day, but those sorts of things. So it is Monday to Friday at the hours that they'll designate for Esperance.
So is there anything more that you want to let the community know about the McGrath role that you have? Because that would be really helpful, because I know you have 2 roles. So I thought we'd cover the McGrath breast care nurse role, which is really vital for our town. So I guess I want to say on behalf of our community, thank you for all that you do. But also to be able to say, here's a platform to let the community know. You said that you provide support. So I'm interested to know, what does that look like? What can people expect? Like when we have a broken arm, we know that we're going to come to emergency, have an x-ray and walk out of here with a plaster. And I know cancer isn't necessarily that straightforward, but it would be helpful to know a little bit more about the things that are available or would be likely to be experienced.
Well, first off, I'll say that I don't work alone. I do work within a fantastic team. And so my role is to be, obviously, as part of that team, to put referrals in as and when they're needed. So when patients return from Perth, say post-surgery, I'll contact our ambulatory care services to arrange wound care dressings and so on. The other thing, myself and another colleague, the cancer support nurse, Ali, we run is the cancer support group. And we run that once a month, usually over at Population Health, and we have either guest speakers in or we might talk about topics that are relevant to the ladies that are attending. The other thing that we do is finances always comes into play when anyone has to keep travelling for treatment. I can link you in with the PATS office and just guide you a little bit in that area. The other thing is counselling, because cancer can affect pretty much the family. So I don't do the counselling as such. I will refer on for counselling services. Someone in your corner, basically, because over the course of cancer treatment, you do see a lot of different specialists. You'll see your surgeon, you'll see your oncology team in Perth, you might see a variety of specialists here, then a radiation oncologist and so on. And so sometimes it's nice just to have one person who you can come and see, and I'll be there during clinic visits. And if I'm not at the clinic, I'm usually rostered into chemo, so that frees up the other girls to go and do the clinic. But we just work as a team, and I think that's really important that we do that. And part of my role is to see you, the patient, as not as a patient, but as a person. And that was Jane McGrath's vision, and that's how the whole McGrath Foundation started. Her and Glenn McGrath started that, just to have support for every family going through a breast cancer journey. That was their vision. So it was Jane McGrath's vision, Glenn McGrath, that every woman experiencing breast cancer should have access to a breast care nurse throughout the journey, just to see the bigger picture, to actually see the ladies not as patients, but actually as part of the bigger picture. And I think that's really important. And we're very passionate about what we do in terms of the cancer services. And we just like to support patients to have the treatment, if that's what's needed, here locally. We think it makes a big difference. And on a humorous note, the number one thing patients say to me once they get transferred to down here for continuation of treatment is, at least they don't have to pay for parking. So I know we're making a difference, even if it's just that you don't have to pay your parking fees like you do in Perth. Just a thought.
Absolutely. Sometimes it is really the little things that make a difference. Having been with people and having to visit people in Perth, the parking stings. But that also was a great segue. So from the McGrath breast care nurse role to the other role we've mentioned in terms of the chemotherapy unit, can you give some information about that? Because that is new-ish for Esperance. I know it's been going for a while, but it would be helpful to know what is expected and how. Have you got any suggestions on how people in the community might be able to support either people going through that journey and how we can support the unit? Because now we have it in Esperance, we want to keep it. Not that there's any danger of that not happening, but it would be good to know how we can contribute and support.
So the unit going for about 10 years now, might be just a little bit over that. And so how patients they receive their treatment, they get referred by the Perth oncologist or cancer doctor to the visiting oncologist, who comes down once a month and runs a clinic. And so that's how you can have your treatment here, because you're reviewed regularly by a visiting oncologist. As to what the community can do to support, well, you already do a lot. And I know that we've been able to access some of the funding that's been raised for cancer services to actually provide our patients with what we call care kits. So when you have chemotherapy, there's a variety of side effects that patients may have, one of which is sort of dry skin and cracked and brittle nails and so on. And so we've been able to put together some care packs with some products that have been very kindly supplied by one of the chemists in town. And so patients are able to take home these care kits so that they can keep their skin from drying out or some of these side effects to a minimum. So you are doing a lot in the community. You do support us. So we'd love to have you keep on doing that. That would be great. Thank you.
No worries. It is always nice to know, whilst we had said before, everyone knows someone who has either experienced or is experiencing. And is there anything else you'd like to add?
Yes, just another example of some community funding that we'd really like to thank the community for is the cancer support nurse and I have been able to put together annual Look Good, Feel Better cancer workshops for patients. So we just had one actually at was it last week, the 19th of November, and we had 5 ladies who were able to come along. And so we actually got all that started. The products that the ladies use are all sent down by an organisation called Look Good, Feel Better, and they do an amazing job. And that's where the cosmetic industry, they actually donate products for these skincare kits. And then to run the workshop, to actually get it started and to maintain it, we've been able to access some of the funding donated to cancer services. And we know, because we see the ladies at the end of the workshop, and we just love it because they do the whole skincare routine and makeup. And if they've lost their hair, they've got opportunities to borrow wigs, try on scarves. And it is a really fun, lovely morning. And we just love it, and we hope to continue to put those on for many more years. So if you are thinking you'd like to support, that would be great, a donation to go to cancer services, and that's why we sort of tuck it away and then we use it when we need it.
That's fantastic. I know, again, it's the little things that make a really big difference, isn't it? Is there anything else that you want to add to let the community know? I know that currently we're into December, and traditionally Women's Health Month is September or October. October is...
Every month, girls. Every month. Look after yourself.
So is there some tips on that, like on a monthly basis, that we can all do to do that little thing that's going to make a difference?
Yes, so October is the official month for Breast Cancer Awareness Month, but you're right, every month should be self-care month. We should look after ourselves, absolutely. But specifically with October, the McGrath Foundation partner up with, BCNA, which is the Breast Care Network of Australia, and they all work together, the organisations, and they've got a beautiful program, Curve Love, which is, love your curves, know your curves. If you grow them, know them. That's one of the slogans that the McGrath Foundation promote, which is fantastic because, come on, girls, we grow them, so we ought to know them. And the other thing I love is the Feel on the 5th concept. So on the 5th day of every month, you set a little reminder on your phone or your calendar or whatever to do your breast self-examinations. You may find partners are helpful or not in this area, but generally that's a really great and fun way to remind yourself, it's the 5th, I better do my breast self-examination. And you can find out how to do that. You can just Google reputable websites. The McGrath Foundation will have one, and the bcna.org will have one, and any breast care or breast cancer care website. Yes, so there's a lot of things that we can do to look after ourselves.
Thank you so much. And it's not all, hardship, but there's a little bit of fun involved as well. On that note, would you like to add anything else that you want to let the community know?
So, as I said, I'm employed by the McGrath Foundation, so I'm funded by them, and I'm employed by the hospital. So I'm based up at the hospital. So my services are actually free to you as a consumer. As I say, I am 2 days a week, but not necessarily the same 2 days in each week, because I do work in our chemotherapy unit as required. But my contact is obviously up at the hospital, 9079 8121. So you can give me a call, leave a message, and I'll get back to you. And the other thing is, yes, don't forget forget, girls, feel on the 5th. And the other thing is the Breast Screen WA van. So 14th of December to the 28th of March. Please give them a call, 1320 50, and book an appointment. 50 to 74 years of age, but if you are 40 to 50, you can do that also. And if you are over 74, you can also do that. So if I can encourage your listeners to do that, that'd be great.
Jo, I want to thank you so much for your time. I really appreciate it. Not just your time today and, letting the community know about your existence and also the things that we can do to take care of ourselves, but the fact that you're here helping people when they are in their hour of need. I think that's a very noble, and I'm very grateful to know that you're here doing that. Now, on Hope FM, we love to ask 3 questions around our tagline, and I'm wondering if you'd be willing to answer them. So we're a radio station. So the first question is around, what was the first album you purchased or that you were given?
Previously, it's Bryan Adams, but I also want to add Diesel. Do you remember Diesel?
Yes.
Years ago. I think I had a CD.
Awesome.
Do you remember?
We'll see if we can dig some out. So our tagline is bringing hope, sharing joy and building community. You definitely build community, so I want to thank you again for that. With the sharing joy, we'd love to know what makes you smile.
Well, most recently, my involvement in the local Bijou Theatre, that made me smile. My children were involved and I thought it was a fantastic show. Also a great community event. So it makes me laugh even now thinking about it.
Yes, it was awesome. And lastly, we ask, so what do you hope in or what do you hope for?
Am I allowed to say world peace? I can say what I like, world peace. And I would really love to be able to have the option of travel again. I think perhaps I speak for many of us here, and I think we've really missed the opportunity to travel.
Yes, I think you'll get a ditto from lots of people about that. I want to thank you so very much.
All right. Thank you, Meredith. Thanks for having me, and thank you, listeners.
Welcome to Esperance. Hope FM 103.9.